evidence-based medicine, and also tell you about how evidence-based medicine has developed over the years in in various parts of the world. And as we know, it started somewhere. Evidence-based medicine, as such, is a old concept. In some of the write-ups of Arthur Conan Doyle, in Sherlock Holmes, he talks of this term called evidence-based medicine, actually. But then, officially and clinically, and also more academically, this term has come to use after in 1990s. Somewhere in 1994, 95, there were a group of researchers and physicians in Oxford University who decided to have something known as a Cochrane collaboration, and they set up Cochrane collaboration, and with that, actually, evidence-based medicine got a lot of uplift, and later on, as I show you in the history, it became a part of curriculum of several universities, as well as several centers devoted to practice of evidence-based medicine was started throughout the world. So actually, evidence-based medicine, the definition, according to McMaster University, which is also considered to be the mecca of evidence-based medicine, there the definition which was given was that this is a science of turning clinical problems into research questions. And that means all our day-to-day problems would get turned into research questions, and then we would access literature related to that question. That means we would go to the library, look at the journals, look at the textbooks, talk to various researchers if they are available, and we access whatever is published or unpublished data on that particular research question. After we have accessed that information, then we would be appraising whatever we got, which was relevant to the research question, which would involve a lot of screening of whatever information we get. And we start critically appraising various articles which can get attached to these research questions. After that, after critical appraisal of these articles, we come out with with certain articles where some data is available, and that data can then be pooled, and a consensus can be built up, which could be the net result of pooling of data of various studies, and that is what is known as meta-analysis. That would be done. And then we apply that information which has been there, we interpret that information, and we apply it to our clinical practice and see how it is working. And to see how it is working, we would actually be auditing the evidence. That means whatever was applied, whatever interventions were applied to patients, we want to see how their effect has been. And all this comes from scientific research findings. And basically, it's a kind of translation from scientific research findings to solve clinical problems. So actually, I would request all the participants to think of a research question which they would like to work on, because at the halfway through the session, I would like to ask you, maybe have you give your questions in the chat box, and then we can discuss some of these questions, whether they will form questions for further research in the field of evidence-based medicine. So coming to the next slide, this is just to say that we do have in our group people who are relatively senior like me. And this particular slide actually shows your years since graduation and your knowledge of current best care. And as you can see, as our years since graduation increase, our knowledge of current best care decreases. Although this is a relatively old study, it is actually part of a systematic review. The next, just click the next one. And it is based on 62 studies of systematic review, in which it was shown that with age, there is a fall in our knowledge of current best evidence, and we need to update ourselves very, very regularly. But these days, this was a relatively older concept, and with the recent years, we know that knowledge has become available on the click, just on a click on the computer, on the mobile phone, and many people would actually keep themselves absolutely updated. And sometimes I see very senior people who are so well updated that they certainly know more than the residents. And then, they can actually transmit their knowledge to people. And many times, it is these new concepts which develop, which are much better known to the senior faculty or the senior people, and they can then lead the residents and the students towards a more meaningful interpretation of knowledge. Next one, please. Yes, next. Yeah, so this I've already told that. So this is actually evidence-based practice timeline. This is a kind of historical perspective of evidence-based medicine. And those of you who are now getting initiated to learn about this field, it is important to know how it has developed over the years. Now, this first picture in which you see Archie Cochrane, he was a British epidemiologist, and it's actually on his name that Cochrane collaboration was formed. And now we have the Cochrane Library, which is a database of systematic reviews. And, that is something which we used now in day-to-day life. We know that every 8 minutes, they say one Cochrane review is cited. So, so this is how we carry on doing our work. And so, Sir Dr. Archie Cochrane actually worked in Britain, and as a medical student, it is known that he carried a placard throughout the streets of London, asking for the healthcare to be free. And we know that following this kind of persuasion, NHS, that is National Health Service in England, is a free service, and they don't charge for this care. So he wrote a book called as Effectiveness and Efficiency, Random Reflections on Healthcare. And that book actually gave us this concept that a lot of research has already been done. But we are not, a lot of research has been done, but we are not actually using it. And we go on sometimes doing research without looking at the data, which is already there. So it became extremely important that before we submit any research proposal, we should have seen whatever has actually happened in that particular area. So Dr. Archie Cochrane gave this concept, and subsequent to that, next one, please. There were few more legendary professors who have defined these terms, and the definition of evidence-based medicine, which I told you from McMaster's University, came from Dr. Dave Sackett, who was a professor in McMaster's as well as in Oxford. In Oxford, he actually introduced several things like evidence-based medicine rounds on his, usual bedside rounds. They would carry what is known as cow. A cow. Cow means computer on wheels, because at that time there were probably not many sophisticated laptops, and so on that particular computer, with the help of internet, they will access information and apply that to the bedside, to the patients who were there. And so these people were really luminaries who led this concept of evidence-based medicine, that we should base our treatment or of the patients on clinical evidence. That means something which is published as research findings, which has been appraised, and which is considered to be extremely useful. Now, after this was Sir Ian Chalmers, who was a professor of obstetrics and gynecology in Oxford again, and they created a database of systematic perinatal systematic reviews and childbirth. So these people were actually absolutely involved in creating Cochrane collaboration as well as furthering the cause of evidence-based medicine. And Dr. Ian Chalmers was awarded to be the honor of British Empire. And then we have Dr. Gordon Guyatt, who is a professor of medicine at McMaster's University. And he's the one actually who's given this term called evidence-based medicine. So he's credited with calling it as evidence-based medicine. And we actually tried to translate this term to Hindi. And we labeled our website, which was there as such, SACH, and that was Saksha Adharit Chikitsa. I can see a lot of people from Banaras Hindu University. So I know that we have several, pundits of Hindi and Sanskrit over there, and we would like to have their opinion on whether this could be called anything else in Hindi. So this is after this there were several centers of evidence-based practice throughout the world. Like it started in Canada and UK. US was a little late to join them, but then there were centers in Australia, even China, then India. In India we had this South Asian Cochrane Network and Center at CMC Vellore, for which we were all the coordinated collaborating sites. And but that now is getting converted into an Indian Cochrane Center. Then there were several other people, especially in the field of pediatrics, who joined this movement. And we had a team from Royal College of Pediatrics and Child Health, headed by Dr. Ruth Gilbert, who is from Institute of Child Health London. And she conducted several courses, and that was in the beginning period of 2000s. And they also conducted courses in India, and then we started taking them up in Indian Academy of Pediatrics. In fact, there was a collaboration between Indian Academy of Pediatrics and Royal College of Pediatrics and Child Health. And then we kept applying for a center, for an ICMR Center for Advanced Research for Evidence-Based Medicine, which we were granted. And looking at our work, which was considered to be quite useful, we were given continuation after 5 years for this particular center. So now the thing is that we have to carry out a number of these courses which are for educating the pediatricians as well as other members of the medical fraternity, because pediatricians actually have been quite to the forefront in Cochrane collaboration as well as in evidence-based medicine. And actually the logo of Cochrane collaboration, which is shown here in the slide, is based on a systematic review which was done on use of antenatal steroids for preventing premature birth in mothers. And that giving antenatal steroids prevented the occurrence of hyaline membrane disease in premature babies, and that actually ultimately became the standard of care. And here what you see is a forest plot, and when we talk about systematic reviews, you'll find that these forest plots are actually very, very important for interpretation of systematic reviews. So actually the practice of evidence-based medicine is based on using evidence from the best quality evidence, which comes from systematic reviews or from randomized controlled trials. Now, most of the systematic reviews of interventions are based on randomized controlled trials because those are considered to be the best quality evidence. So as pediatricians or as physicians, we should know how to interpret the results from a systematic review and then see whether they can be incorporated into guidelines, which are usually adopted by many professional societies for practice of therapies for certain diseases. For example, we have asthma guidelines, and every 2 to 3 years these guidelines get updated because there is a whole lot of information which goes on accumulating relating to asthma, and which comes in the form of, say, randomized controlled trials or of interventions, whereas there are certain things which are also related to uh, therapeutics as diagnostics. And for example, now we have NO, which is exhaled nitric oxide, which is becoming an important marker in patients with asthma. So sometimes all these things get tested against the gold standards, and they also form systematic reviews for creating evidence for practice of medicine. So next slide, please. It's so there are some slides about Cochrane collaboration, which is so before I go to that, I would just like to tell you that systematic reviews are as a result of collaborative effort of the research teams which are formed to do a systematic review of a particular intervention. This should have a well defined research question, and then it has a definite methodology of how to conduct that systematic review. Now, systematic reviews which are published in the Cochrane Library, because many of you must have had experience of consulting Cochrane Library whenever you are preparing your talks or rewriting a proposal for research projects, or even doing their thesis. Number of times students refer to that. So now these Cochrane reviews actually form the Cochrane Library, and they are created with the efforts of the Cochrane collaboration. So I'm now talking of the quality systematic reviews, which are published in the Cochrane Library. Because there are other non-Cochrane systematic reviews also, which are also high quality, and they are published in different journals. So it is not just the Cochrane collaboration which is doing systematic reviews. They have given the concept and they have given the methodology, but there are now reviewers who are using those resources plus other resources which are there, because ultimately it boils down to using statistics and your critical appraisal skills effectively. And then you can write systematic reviews and publish them in the other peer reviewed journals. For example, in the COVID times, so many systematic reviews are getting published. And for every intervention, whenever you are reading an article, it is written as a systematic review. But many times when we have reviewed them, they do not fulfill the criteria of being systematic reviews because they have not had a definite methodology and special attempts at decreasing the element of bias which comes in whenever we are reviewing research. So this Cochrane collaboration has actually started a project which is for COVID as well, and that is for doing rapid reviews. So there is a definite methodology now for doing rapid reviews in which some of the areas do get compromised, and but the results come up much faster. For example, for doing a review, otherwise you need about 6 months, but these reviews can be done in a period of 1 month or so, because in any case, rapid reviews which were done for COVID in the beginning, because there were no therapies, there were hardly any randomized control trials on this particular aspect. So this new methodology had to be started. So there are about 40,000 researchers now in Cochrane collaboration. They are professionals, patients, carers, and people who are interested in health. They respond to the challenge of making a vast amount of best available evidence generated through research, which is useful for informing decisions about health. And Cochrane is a non-profit organization, and with collaboration from 120 countries, which are working together to produce credible, accessible health information that is free from commercial sponsorship and any other conflict of interest. So these are points which have to be underlined, that for principles, for knowledge to be absolutely unbiased and free from any commercial conflict of interest, it would have to be centrally funded. It should be funded by national governments, so that all decisions which are made are totally, absolutely free of bias. Next one. So, systematic reviews attempt to identify, appraise, and synthesize all the empirical evidence that meets us, and and it should have specified eligibility criteria to answer a given research question. Researchers conducting systematic reviews use explicit methods aimed at minimizing bias in order to produce more reliable findings that can be used to inform decision making. Now, systematic reviews, that is why, are not just used in clinical medicine. They are not just used to make clinical decisions about patients. They are also used to advise policy. For example, the governments, when they're making decisions about certain interventions which have to be used, they would consider using this scientific evidence, which is there, in literature, or on even on case files, or files which are there with the pharmaceutical companies. As nowadays, evidence-based medicine is something which has now become a word which is everybody is using that word. And recently I was listening to an ad by the Patanjali Yogapeeth, and even Baba Ramdev was referring to evidence-based medicine, that this particular therapy is based on evidence. So people are getting interested in this particular branch of medicine, which is almost like a branch of medicine. It is a new paradigm which has been added to medicine in the recent times. So there is a need for the policymakers to. So this is what is known as evidence-informed policy making. For example, we have several vaccines which have come for COVID these days. Like we have Covishield, which is from AstraZeneca. There is another vaccine, Indian vaccine, Covaxin, which has come from Bharat Biotech. And it was a very difficult decision in the beginning, and because a lot of data was not available. But then government is actually trying to use evidence here, and that is how the DCGI or FDA, they make their decisions about what is available as an evidence about the efficacy and safety of a particular vaccine. So these have been very major healthcare decisions which have been based on evidence in the recent times. Next one. So, since ultimately, when we start teaching about doing systematic reviews, we mostly follow the methodology of a Cochrane review. So, I should also be telling you about systematic reviews, which have methodology, but we should also know what is a Cochrane review. So, Cochrane reviews are systematic reviews of research in healthcare interventions or health policy that are published in the Cochrane database of systematic reviews. And like any other review which is there, or any other studies which could be there as primary studies, these reviews are also of different types. Now, this applies not just to Cochrane reviews, it also applies to all other systematic reviews. So they can be intervention reviews, which assess the benefits and harms of interventions which are used in healthcare and in health policy. Then there are diagnostic test accuracy reviews, which assess how well a diagnostic test performs in diagnosing and detecting a particular disease. In the first variety, which is of intervention reviews, we consider randomized control trials as the primary constituents of intervention reviews. But then the other studies, if randomized control trials are not available, then they can also be based on certain observational studies. And critical appraisal of randomized control trials will be taken in our next session when Dr. Joseph Matthew will teach you how to critically appraise a randomized control trial. For diagnostic test accuracy also, we have a session in which a paper which would be devoted to diagnostic test accuracy will be critically appraised, and we will give you the tools which are related to how to assess a diagnostic test study. Then there are certain methodological reviews which are based, which address issues relevant to how systematic reviews and clinical trials are conducted and reported. For example, there are certain methodological issues which will come into play when we are talking of rapid reviews, these reviews which have recently been introduced. And then people who would be dwelling upon methodology of such reviews, these will be considered as methodological reviews. Then there are qualitative reviews. Now, qualitative studies, as you know, they are not studies in which you have interventions. These are the studies which are mostly observational in nature, which are based on people's experiences. And when you are talking to, say, a patient regarding what is his quality of life after getting a certain intervention, or what is the feeling that he is getting after a particular treatment. So, this type of studies are known as qualitative studies, and reviews which synthesize qualitative evidence are known as qualitative reviews. And for this particular course, we are not covering qualitative reviews, but we may conduct a separate session for how to assess these qualitative studies and do systematic reviews of these studies. Then there are prognostic reviews, which address a probable course of future outcomes and of people with a health problem. So these will be based on, for example, let's take again example of COVID, in which we know that the prognosis will depend upon presence of comorbidities. If a patient gets COVID infection, if this patient has obesity, hypertension, diabetes, immune deficiency, being on immunosuppressants, then the possibility of this child faring, this person not doing very well in treatment are high. So these are prognostic reviews in which one would assess what is the effect of various risk factors or prognostic factors on healthcare. So, systematic reviews base their findings on the results of studies that meet certain quality criteria, since most reliable studies will provide the best evidence for making decision about healthcare. So I think I will just stop at this for about 2 minutes, and I will request our